Before we get there, though, since we're talking about makeovers, Dr. Steve Mulholland is here. How are you?
I'm very good, thank you, Tracy.
This is really kind of exciting because, you know, we talk all the time about different cosmetic procedures, you know, the stuff that's really easy, the stuff you can get done over lunch hour, but we haven't really paid a lot of attention to women of color who have not been able to get certain procedures until recently. And now you're even seeing a big difference in your demographic right now coming to Spa Medica.
Yeah, well, Toronto's a very multicultural city. We have lots of women of color, Asia, the Mediterranean, the Caribbean, and until the last 5-6 years, we didn't have the technology that could bypass the darker melanin, and a lot of our techniques work by stimulating the skin with techniques that can lead to unwanted pigment, worse pigment, or scars. Now we have some very high-tech ways to bypass melanin, which opens up rejuvenation and the techniques we're going to see today to really skin type of any color.
I love that. So if you've got the inclination now, the technology is there to support you. Let's start with Roddy. So we're going to talk a little bit about the skin care, the lasers that you did on her face. What was her issue?
A Caribbean skin type, darker skin, some hyperpigmentation on the cheeks, some unwanted pores, texture, some old acne scars. And so using a technique, they're using ultrasound waves to take off the outer dry layers of skin. And then we're using a device called the Fractora and devices like it that use needles that are silicone coated. So they can go into the skin and the heat is delivered deeply but bypasses the superficial melanin. So we can get to the heart of tightening, pore reduction, acne scars, and tightening without the thermal stimulation that leads to the problems. And so it allowed someone like this to really change their complexion, to get tighter skin, smoother skin,
and less
pigment without the risk of making the problems worse.
That is very cool. In the past, then, what was missing that why Roddy would not be able to
Well, we would use lasers and energy devices that hit the skin and create heat, which is okay if you have a lighter skin type, but the heat itself would create hyperpigmentation in darker skin types. And so now we can bypass that superficial layer and target deeply.
Very cool. Okay, does any of that stuff hurt?
Well, pain
I'm going to ask you that for every single one.
I would say that the pain of the treatment is far less than the pain of growing old. Yes.
Okay.
We do use topical anesthetic cream, which works, and little air chillers and techniques that numb the skin while the treatment's being done. So everything is very comfortable.
All right. So there might be a little pinchy pinch.
Pinchy pinch, yeah.
All right, okay. So that requires about 6 to 8 treatments over 8 to 12 weeks and a 50 to 70% reduction. Yeah,
if you look at the before and afters, you will see that typically for texture, wrinkles, laxity, we can make a 30 to 70% improvement depending on the skin type and the age.
Yes.
And that's pretty predictable.
Okay, Roddy looks good. All right, let's take a look at Lola. So Lola had laser hair removal done. Now, why would Lola not be able to get this done in the past?
In the past, again, we would use laser energy that would hit the skin and want to target the hair follicle, and the hair follicle is dark. Unfortunately, the skin is dark. So the laser would hit the skin and explode with too much energy, and you'd get pigmentation disorders and potentially scarring. Now, with this technology called the Gentle Max Pro, we can use a shot of cryogen. You see that little burst of that looks like steam? That's cooling the skin to less than 0 degrees for a millisecond as the laser goes into the skin, bypassing the risk of melanin reaction or pigment reaction. So again, dark skin with dark hair can now do hair removal safely and comfortably. The cool thing about the cryogen spray, it renders the treatment painless.
Oh, that's so good. That was a key word for me. And how many times does she need to go get that done? And at some point, will there just be no more hair growing?
We're very good. For 15 years now, we've been doing laser hair removal, and we're very good at we have to treat 5 times, to answer the first question.
5 times, okay.
We have to treat once every growth cycle and get all the hairs growing. And then after 5 treatments, on average, 75 to 90% reduction.
That's amazing. So you have to come in nice and shaggy, though.
We want to see the hair. You don't need to come with the bikini or the facial hair and a Fu Manchu. It doesn't have to be, but we have to at least see the stubble. And do not wax before the laser hair removal because you remove the target. We use the hair shaft as the actual target, a lightning rod for the heat.
Got it. Okay. All right. I'm very interested in what happened here with Natasha. So take a look at Natasha. You use SCULPSURE. What is that all about? It's a non-surgical liposuction.
Yeah. So again, in women and men, women and men of color. Typically, we can kill fat without surgery, but we need techniques that will bypass the dark skin. So the SCULPSURE is a very interesting technology. It cools the skin simultaneously, driving the laser energy down into the fat cell. It heats the fat cell for 20 minutes to a certain temperature that fat cells don't like to be, and then the fat cell dies.
Okay.
Now, we have other technologies where we can suction couple and cool,
Yes.
but the cooling can lead to hyperstimulation of the skin and hyperpigmentation. And so for the darker skin site, the SCULPSURE is the better technology.
Okay, so we all know that stomach. Look at that stomach, right? So
Predictably,
the pouchiness of it, the looseness of it, the elasticity is kind of gone, especially if maybe you've had a child or two. So it's less, you see the difference less dramatically in Natasha, but it's there. You can see a difference.
Yeah.
How many treatments would she have to go through?
In general, it's 2 treatments, 6 weeks apart, and predictably, as Natasha, she had a pinch reduction about 3 centimeters after 2 treatments. So we can pretty much do 1 to 2 centimeters of pinchable fat, bra line, hips, tummy, outer thigh, inner thigh, arms, all the stubborn areas without liposuction.
You know what I'm going to ask you? Does it hurt?
No, it's one of these technologies, again, the cooling eliminates the pain. So I would call it a 2 out of 10 on discomfort, you know, 8 out of 10 being plucking or waxing. So it's very, very comfortable. Yeah.
All right, okay, can most of us pluck or wax? The other thing I want to ask is about price.
Most of these things that you see are going to be between $250 and $500 for small zones and $750 to $1,000 per treatment for larger zones.
Right.
And most of them have very long-term results. So generally, pretty good bang for your buck.
But don't just leave there and go have a burger and fries. Like, you kind of have to change your lifestyle as well so that it stays.
A commitment to that change is important, yeah.
Okay,
It's not a
all right.
substitute for going to KFC.
Okay. Oh, well. All right, let's take a look at Marcia now. Let's talk about stretch marks. Anybody with stretch marks out there? It was always that if you had your stretch marks, this was it. There's nothing you can do about it. That has changed.
Yeah, so with women of color, it's usually going to be a light stretch mark on dark skin or a dark stretch mark on dark skin. And again, our techniques for lighter skin involve thermal stimulation and heat and changing the collagen, which led to problems in darker skin. Now you're looking at technologies like this one where we're using a little injection device that shoots with under pressure a little bit of product into, this is a little dilute Juvederm being projected into the stretch mark to remodel the collagen.
It went away.
The stretch marks can look significantly better with these techniques and technologies. So again, another way to trick the skin into responding how we want, but bypassing the risk of pigment change and scarring.
Are there any places where you can't get stretch marks removed?
No, everything's
Because some
open
women,
to-
like, we can have them anywhere, anywhere you've had a big amount of growth or just the elasticity couldn't take it, and you can do that anywhere.
Yeah, anywhere. In this area, on the arms, the outer thighs, front of the thighs, of course, the postpartum tummy, all amenable to stretch mark improvement. They don't go away completely, but significantly less.
Okay, I'm still hooked on the tummy one because I don't really care about my stretch marks that much, but the tummy, ooh, that sounds tantalizing.
It's a gateway treatment to other treatments.
Okay, let's look at Lilybeth now. So she had acne scars and hyperpigmentation. What were you able to do?
So very common, Asian, Hispanic, to have acne scars and pigment problems.
Yeah.
And what you're looking at here is a way that we trick the skin with a laser. Rather than using a shorter pulse duration, we use extremely short pulse duration, like a billionth time shorter than the blink of an eye. And in that pulse duration, it ends up shattering the pigment, and that shattering wave or sound wave stimulates collagen production. So there's actually no heat production, called a Picosure or PICOFACIal, and it works beautifully on women of color for melasma and hyperpigmentation. It's the #1 go-to treatment that I do right now for women of color who have discoloration.
Right.
And they treat it with typical photofacial treatments, your color gets worse. This is one way to make that color get better because it doesn't use heat, it uses an ultrasound shattering effect. And it also treats texture like acne scars.
That is so cool. So, I mean, obviously, people, if they're interested, can call you, talk to you, figure out what's happening with themselves and what they might be able to get done in terms of the technology out there, because it really is wide-ranging. But you've given us a good little taste today of all the procedures that can happen, especially the ones that don't hurt.